Hi, this is Dr. Farley, and today I'm going to go over with you some very, very interesting information. Again, I'm a diligent student, always studying, and this to me is just really a wow segment that I'm about to give you as far as the blog is concerned. So listen to this, take some notes, a lot of good information. So we want to talk about again, everything that we do here in our clinic is based on neurobiomedicine. We're trying to restore normal physiology, get things to work properly again. And when we drop the marker, it's going down. When we restore function, things have a chance to work. It's physiological compatible care, which means that we're restoring how things function, which in turns meaning that things can work better, which usually means that our patients feel better in 2 to 4 weeks. 91% of our patients feel better in 2 to 4 weeks. One of the key things that I want to go over here is just some basic physiology again. And again, our entire program is based on restoring normal physiology. We're not here to treat any disease. We can influence all disease, but we're not here to treat any disease. So I just want to go over with you again that there's really 9 systems inside the body. And today I'm going to introduce you to the 10th organ system. So the 9 systems inside the body. Number 1 is the master nervous system. It controls and coordinates all other systems. Secondary system is a musculoskeletal. Secondary system, vascular and viscera. Secondary system, your lymphatic. Secondary system, digestive. Secondary system, respiratory. Secondary system, urinary. Secondary system is the reproductive, and secondary system is the endocrine system. And today what I want to go over with you is there's another system, and it's called your microbiome. And we have to view this as, although it's a separate and distinct cells, these are actually bacteria that live inside of you and basically in your large intestine. It really is a system, and it is totally connected to this master system here. That's you. The other thing that's very interesting also is the body has an intelligence. So you'll see all over my office and all over my website, the power that made the body can heal the body. Our objective is to restore normal physiology and remove what the body and the brain doesn't need and give the body and the brain what it does need so it can restore how it works and in turn raise your level of healability, and you can function better, feel better, and actually get a huge improvement in many issues that people are not getting. When all we do is just take a drug to try to mask a symptom, it'll never bring you there. It can't bring you there. So back to this microbiome again, and what I'm calling the 10th organ system. The microbiome can be majorly influenced by many different things. It can be influenced by environmental xenobiotics. That does include vaccines, flu shots. It can be influenced by hormonal imbalances, antibiotic use in your livestock, that's your food, a pro-inflammatory diet, pesticides, mental emotional stress, chemical stress, or physical stress can influence the microbiome. Lack of fermented foods, not eating enough fruits and vegetables. By the way, we should be eating between 6 and 8 servings of fruits and vegetables a day. Each serving is the size of a deck of cards. So we are way off on that. Herbicides, medications, drugs, fungicides, GMO foods, hormones in the livestock and dairy products that you're eating, smoking and alcohol. All of those things can whack out your microbiome. And then also over a time frame, your microbiome, because it sits inside the gastrointestinal system, can also start to create leaky gut, can create leaky brain, issues with all kinds of problems throughout the body, and it can also lead to a stuck, sustained inflammatory state. But the thing that I want to go over with you today are the idea of the master nervous system, again, regulating all the subsystems in your body. Now, if it's your own cell, it makes sense that your nervous system could control and coordinate it, and that's all the subsystems that we talked about. But you mean to tell me, Dr. Farley, that this microbiome that you're calling the 10th system, actually those bacteria that are not even our own cells are also regulated by the nervous system? Absolutely yes. If your microbiome is in good balance, it's called eubiosis. If the microbiome is off and there's too many bad guys, it's called dysbiosis. And believe it or not, your nervous system is sensing and talking, communicating back and forth between the brain-gut and the gut-brain connection. and there's communication going back and forth with neurotransmitters, peptides, hormones, all kinds of chemicals to communicate back and forth. If there becomes a dysbiotic state, too many bad guys in the gut, believe it or not, your brain knows. The power that made the body heals the body. There's an innate intelligence inside there. You can call it God, whatever you like. The brain knows. And what the brain actually does is it changes the amount of neurochemicals and peptides and other chemicals released into the gut. And believe it or not, it actually increases the growth of good guys. Can you believe this? It's really unbelievable. So part of our treatment here is when we do brain-based care on someone, you cannot get a healthy gut with a bad brain. You cannot get a healthy microbiome with a bad brain. So brain-based care is essential to all of these issues responding properly. What you also want to know is that there are 3 types of biotics. There are prebiotics, probiotics, and postbiotics. The brain can release chemicals and influence your probiotics, the type and good guys or bad guys, and the quantity in the gut. Prebiotics also are regulated by the brain, but also your prebiotics are going to be coming mainly from your different foods that you may be eating. The non-digestible part of fruits and vegetables is called fiber. Those fibers are the prebiotics foods to grow the probiotics bacteria. If you're not eating a minimum of 6 to 8 fruits and vegetables a day, you'll never have a good microbiome. And if you don't have a good microbiome, you can never achieve health. Mentally, physically, chemically, psychologically, never. It just doesn't happen. And then after a while, assume that you get a lot of these normal probiotics, a good ratio of good guys to bad guys, and you're in a eubiotic state. Then what also happens, just so you know, as you eat these foods and you take a bunch of herbs and even some of the other phytonutrients that you take, they actually don't work directly on your cells. What do? They go down and they feed your probiotics, your good guys. Those probiotics produce postbiotics. And those postbiotics do all kinds of things. They influence your metabolism. They influence how your brain works. They influence your metabolic rate. They influence your leaky gut, non-leaky gut. They influence your immune system. They influence pain. They influence your energy levels, your focus. I mean, they do everything. So it's really a very symbiotic relationship that has to happen. So the point here again is that one of the areas that we're a master in our neurobiomedicine program, we understand the brain, we understand the gut, and we understand the microbiome. There's no one that can go as deep as we can in understanding these things and the interconnection. And yes, they all have to be worked on for you to get the best result. One of the reasons why we have success with these chronic cases is because we're so diligent at uncovering what are your specific root functional causes, which gears are off inside of your brain and your body, and then how do we make them work better. And by doing that, through physiological compatible care, we give you the opportunity through a new approach, not a second opinion, a total new opinion, to try to restore your level of healability, and you can get results that you've never gotten before. So I hope you found this helpful, and this video again is on the 10th organ system called the microbiome. Thank you, and have a great day.